Welcome back to our five-part series of Take Control, Navigating Obesity Treatment and Advocating for the Care that You Deserve. Yesterday, we talked about weight wellness, obesity, what that means, why does it matter, and all the myths that are out there. And so that was what we dived into yesterday. If you haven't watched it, please go back and watch that. If you haven't shared it with a friend or a neighbor, please go ahead and do so. It is important for us to have healthy communities where we don't shame each other and we are looking out for each other so that we can stop the pandemic of obesity. Now, today I want to focus on the multifactorial care for obesity, right? So I'm going to take a deeper dive into what that care looks like and what it isn't, so that you don't get carried away or thrown off by just the diet culture or a prescription, because it's more than just that. All right, so let's start off with what should that look like? In my practice as a family physician trained in obesity care, I take a patient forward approach. I don't label anyone as obese. Even the word obese, I'm not fond of. I don't say the obese patient, I say the patient with obesity. I make sure my practice is suitable for everyone of all shapes and sizes, and I don't label anyone. So when I have patients that come to me for weight management, weight care, I take a deep dive. I want to find out what is the root cause. How long have they struggled with obesity? What have they used to help? You know, have they done diets, different diet cultures? What was their lowest weight? What was their highest weight? What were they successful at? What were they successful at? I mean, I've had patients where they were probably like 300 to start off with, and they get to me at 250 or a 220. We will very quickly make an assumption that that's where they began. But no, if they started from 300, they've made a lot of progress. So it's about congratulating the progress and the effort that was made. So for me, I take a history. I have additional training in lifestyle. So I dive into the medical history, social history, family history, surgical history. I even dive into the medications. You'd be surprised. There are medications that make one gain weight. Yes, it just affects your hormone balance. It affects your metabolism. So I dive into their medications, even over-the-counter medications, right? So it's a thorough history. It's a comprehensive evaluation. I find out about birth control pills, especially for women, because some birth control can actually make one gain weight, so all of this is what I refer to. And then in their personal history, I'm looking into their heart, their lungs. I am diving into everything. I practice whole person care. So that's why my visits usually take anywhere from 60 to 90 minutes, because it's really in depth. I want to find out, if there's a thyroid issue going on. I want to know, if there's a bleeding disorder, if there's depression, if there's any eating disorder, if there's alcohol use. I am very in-depth in my history taking. And then, of course, surgical history. I want to know if there's any mobilization issues, joint that can hinder them from moving or being active. And of course, I want to find out about family history. Yes, if you watch the part one, I did say that genetics does play a big role in obesity. So I want to know, is this a family issue? I also want to know, they typically say that the way one family eats, everybody eats the same way, but I just want to make an assumptions. I want to take a history, right? And then part of my lifestyle medicine skills, just in case you're wondering, lifestyle medicine it's an evidence-based approach to care by using behaviors and habits to not only prevent chronic lifestyle related diseases, but treat and in some cases reverse. Now, what are chronic lifestyle related diseases? Things like hypertension, diabetes, kidney disease, Alzheimer's, and the list goes on and on. So cancer is also one of them. So I dive into nutrition. I take a comprehensive nutrition diet inventory, and I want to know what you're eating. Is your plate balanced? Are you eating out a lot? Are you cooking? I also want to know about movement. Are you exercising? Do you have limitations that will keep you from exercising? Right? I want to know about your sleep. Sleep is so important. If we're not sleeping adequately, we're actually causing a disbalance in our hormones, the leptin, which is the satiety hormone, or the ghrelin, which is the hunger hormone. I want to know how many hours you're sleeping. Is it restorative rest, right? I also want to dive into stressors. Stress is one of those things that make us just gain more weight because it increases cortisol and this what we call fight or flight mode. And so we stay stressed, and that makes us unfortunately gain weight in the midsection. So I want to know, what are your stress relievers? I also want to find out about social connections. Social connections are really good, but it can at the same time either make or break us. So if your social connections are with people that are not eating well, because food is everything, right? If you're in the midst of people that just don't care about their health, is that valuable to you? Meanwhile, if you're around people that eat well, studies show that you actually are more likely to eat well around people that eat well. But at the same time, social connections matter, right, to decrease stress. And then, of course, substances. I want to know about alcohol use. Are you smoking? Are you drinking? All of these things matter. So that's how my history taken is. And for females, we dive into like pregnancy, birth control, like I already said. And then so after all that history, I listen to what their struggles are, and then we go ahead and do the examination. Now, the examination consists of vitals, right? I need to know what your blood pressure is currently. I need to know what your weight is, but I use an in-body scan. An in-body scan gives me information beyond the scale. It tells me more about your lean muscle. It tells me more about your inflammation in terms of, are you drinking enough water? It tells me about fat mass, visceral fat. So it gives me more information than just going on the scale. If you can't measure it, you can't manage it. And it's so important to use an in-body because that gives you more information about the weight and it allows me to create a plan for you. So weight history, definitely like to graph that and know what your weight has been. I want to know when have you been successful? When have you not been successful? When do you tend to put on the most weight? Is it during your cycle, after your cycle? As we get older, we know that women naturally we lose muscle, and muscle is a metabolic driver. So if we lose it, our metabolism slows down. Is that why you've gained weight, or is it a medication that you are on? I remember when, as I to hit my 40s, mid 40s, I would like to cut my hair during the summer months because I don't like being hot. And then I couldn't do that anymore because once I cut it, then it wouldn't grow back. And I was so worried and troubled about it. Okay, is this genetics? What do I need? I need my hair. I need to cover my, need to cover my scalp. My hair needs to grow out. And I remember going to see a dermatologist because I thought, okay, minoxidil, write me a prescription. I hear it makes my hair grow. And I gained 5 pounds in 1 week. I was like, what? My kids were telling me, how bad do you want it? I was like, yeah, yeah, not that bad. So I got off the tablet. So just knowing what's going on, what other things you're dealing with matters. All right. Other things is about, of course, sleep. Sleep is important. What's the quality of your sleep? Like I already said, do you snore? Is there any depression? Now, in your examination, of course, the vitals, like I said, your weight, and then from head to toe. Yes, head to toe. Examination is comprehensive, and it's comprehensive because I need to see, are you anemic? Is there any heart issues, any lung, any abdominal issues? What are your extremities like? So it's a thorough examination. And then once we're done with that, then we dive into blood work. what are the blood work that I'm going to prescribe? What will it be? What necessary? Everything is patient-centered and everything is specific to each patient. But I want to know what your thyroid panel is. I want to know, are you anemic? Especially if patients say they're really fatigued and they're tired, they can't move. Are you anemic? Especially if you're a woman, I want to know what your CBC is, your metabolic panel, liver enzymes. I also want to know what your A1C, what is your fasting insulin? I want to know what your lipids are. So depending on what we gather in the history, I can do more blood work, but it's all shared decision making. So this is important for you to know so that when you are looking for help, it's not a one fix, how did they say, a quick fix. Because if you want to have sustainable success, you really have to dive into the root cause. What is leading to this? Are you an emotional eater? Are you just struggling with eating disorder? So getting to the root cause makes a big difference. And of course, review of system, just making sure there's no complaint. So that's how my visit usually goes. And of course, after the examination, we get the blood work, and then we sit down with a plan. And the plan is always individualized. After taking the history, have the in-body report, do your physical examination. This is the main thing that we're looking at, the 5 parts, okay? So identify and treat underlying medical causes of weight. It could be the thyroid. It could be the medication you're on. It could be sleep apnea, whatever the medical reason, we treat it. And then lifestyle is so important. We look at your nutrition. We also look at exercise, movement. I want to call it movement because a lot of people are afraid of exercise. So movement is so important, but also behavioral. So behavioral is going to be, we'll come up with a good plan that fits your lifestyle. So sleep management, stress management, all of that will be so important. And then we will talk about medications. The next webinar, I'm going to talk about the different medications. How do they work? Which one is most appropriate? But it's so important that when patients are on medications for the right reasons, there's no reason to shame them because the body naturally is going to do all it can to make you gain back the weight, right? So that's why it has to be an approach that you are supported and you have accountability, and it's not a one size fit all for everyone. So I hope that helps. Um, look forward to having you return for the third episode where we're going to be diving into the medications. I'll talk about the first generation and the second generation. All right, looking forward to seeing you.